Okay, we're going to talk about the impact of all this on
Yeah.
education. So,
It's one of it's a third of our score. So
yeah,
education's a big component. And long term, it's probably going to be the most significant effect of all of this.
yeah, longer term, yeah, yeah,
Because a lot of these kids, I mean, my kids, they'll be fine. But there are a lot of kids that are never going to overcome the deficits from it. Without the structure of school, a lot of these kids
Yeah, no,
just
no,
weren't learning anything.
yeah.
Parents might have been trying, but how many?
No, parents can't.
What are they going to do?
Schools.
I mean, we have so many studies now where we looking at the educational deficits from the periods where schools were quote unquote remote instruction, and the deficit is the same as the amount of time they were remote. You were remote 6 months, you're 6 months behind. You were remote a year, you're a year behind. So they were learning nothing.
Yeah,
Most of these kids, on average, if the deficit is equal to the amount of time you were remote,
yeah.
you did a lot of really interesting statistical stuff, but we've got to turn this into plain English, and you know how to do that. And so I really want you to sort of make it clear what's at stake.
Bill Walton Show, April 21st.
Welcome to the Bill Walton Show, featuring conversations with leaders, entrepreneurs, artists, and thinkers. Fresh perspectives on money, culture, politics, and human flourishing. Interesting people, interesting things.
Welcome to the Bill Walton Show. I'm Bill Walton. We're more than 2 years into the COVID-19 pandemic, so by now we should know enough to assess what we've learned about the measures our governments took to mitigate the virus. What worked, what didn't work. Fortunately, we now have a comprehensive comparative study published as a working paper by the National Bureau of Economic Research. It's authored by University of Chicago economist Casey Mulligan and Steve Moore and Phil Kerpen of the Committee to Unleash Prosperity. They compared COVID outcomes in all 50 states and the District of Columbia based on 3 variables: the economy, education, and mortality. Their conclusion? The severe lockdown states suffered much more in overall social well-being in return for not much benefits to health. We can't let this conclusion go. We must absorb what we've learned from what worked and what didn't work. We can't mindlessly respond to the next pandemic, and we all know there will be one, with failed policies. To dig into this, Phil Kerpen, president of American Commitment and one of the authors of the study, and a deep subject matter expert on COVID policies, is here today to talk. Phil, great to see you again.
great to be with you, Bill.
We came into this about a year ago when we were in midstream, and I think you'd reached a lot of conclusions now, but this is the first chance I think you've really had to rigorously assemble all the data.
Yeah, well, I had earlier versions of this paper, but what would happen is we'd say, okay, now we've got, all the states have been through it, we can do the retrospective assessment, and then another wave would come.
Yeah.
And so it's, okay, we'll hold off and wait until we have more data, and so it got pushed a number of times. But I think that even if there are future waves, we now have enough. With 2 years of data, I think we've seen enough to draw some pretty firm conclusions about the relative performance of the states. And as you said, the lockdown states really, really harmed themselves severely. They caused severe damage economically and educationally in particular. And if you look at, what did they gain for it? Did they get better mortality outcomes? There's really only one state, I think, that you can look at and say, the severe lockdown withdrawal from economic activity correlated with much better COVID outcomes, and that's Hawaii. But Hawaii is so dissimilar from the rest of the country in so many ways, being an island. Maybe you can control a virus through non-pharmaceutical interventions in an island, but it doesn't look like you can do it anywhere else. And by the way, even in Hawaii, the price they paid for that was staggering. Even today, as we speak, they've only recovered 90% of their pre-pandemic employment in Hawaii. 90%. They're 10% down, which is just, no place else in the country is worse than 95%, and a lot of the red states are well above 100. So Hawaii, I would say the one place lockdowns maybe arguably worked was Hawaii, but even there they weren't justified. And you look at the rest of the country in the continental U.S., and there's no relationship at all between the the withdrawal from economic activity and the health outcomes.
So we got three variables: health outcomes, economic performance, and education. And how'd you settle on those three?
Well, those I think are kind of the three most significant areas, kind of in terms of impact and values and life. I mean, I think I'm not sure really what else you could put in. I mean, I think
Okay.
if you think about the kind of what broadly are the impacts.
Well, how did you measure health outcomes?
Well, we used two subcomponents of that. One is the CDC COVID death count, the one that you see in all the tickers, the million people, that one. But we adjusted it in two ways. First, we standardized the age distribution for each state to be the same age distribution as the United States overall, because otherwise you're essentially measuring the number of old people in a state, because we have such a severe, I mean, there was 1,000 times difference.
So Florida has more old people. So
Right.
how did you adjust that?
What we did is we took the death rate, so
Yeah.
the number of deaths per 100,000 population in a number of different age buckets. So I think we did 0 to 39 or 35 was the younger one, and then we did 10-year buckets going up, and then we took that rate for the observed deaths in each state, and we multiplied it by the standard U.S. population. So it's the rates that occurred in each age bucket standardized to a U.S. population. And that's kind of the methodology for age adjustment that the government uses.
Did you also adjust for coexisting or pre-existing conditions
We did.
like diabetes?
We did. So we took the age standardized deaths,
right.
and then we applied a further adjustment for the two health conditions that had by far the largest correlation with bad outcomes with COVID, and those were obesity and diabetes. So we took the obesity and diabetes rates of the states, and we did a regression to adjust for those. And so that half of the mortality measure is essentially a health and age standardized COVID death rate. And then the other measure we use for mortality is all-cause mortality. And we took the excess all-cause mortality, again using an age standardized methodology, but we did it as a percentage, which is to say, we took the baseline, the average number of age standardized all-cause deaths, that's from any cause in a state over the last few years, and then we looked at the percentage increase that was observed during COVID. And the reason we did the percentage as opposed to the number is that should capture all of the differences in underlying health, because it's the run rate that's been going on in that state prior to COVID, and then we looked at the percent change. And so both of these measures should give us a pretty good sense, one, of how hard COVID hit in terms of deaths with appropriate adjustments, and the other just overall what was going on in terms of deaths. And that second one also should capture any lockdown effects on mortality, and so it gives us a broader measure of sort of what was policy doing on deaths overall, not just on COVID. And then we equally weighted those two, and that's the mortality score that we used.
Now, you got pushback from Media Matters, of course, which attacked you because you're conservative or you're not aligned with them politically. So has anybody done any real analytical pushback here? I mean, are people pretty much accepting this methodology?
Well, I think the interesting thing is we've gotten some pushback on some of the things we didn't adjust for. So, for instance, people say, why didn't you adjust for population density? And, well, we didn't adjust for population density because it didn't matter very much.
Doesn't matter.
It looked like it mattered early on because the cities got hit first.
Sure.
But over the 2 years, it really was a pandemic. It went through everywhere. The rural areas that thought they were going to be spared were not spared. And in fact, the low density, if you look at the health outcome measure, the low density states didn't do that great on that. Some of these states that did well on our overall measure, like, you look at South Dakota and Montana are at the top of our combined measure, but they didn't do so great on the health component. They did much better on the other components. So we've had that criticism. Some people have questioned why we did any adjustments at all. They say, why, if a state has lots of old people, they should have found a way to protect them. You shouldn't age adjust. You shouldn't health adjust. But I think that, if we did that, we wouldn't be presenting a measure of pandemic performance. We'd be presenting a measure of, population health as it existed prior to this. So I don't think that would be very useful.
So the So we've got, now did you dig into all the reported COVID death numbers? I mean, there's a lot of skepticism that
Yeah.
those numbers are not entirely accurate. There are a lot of things attributed to COVID that
We just,
were really due to something else.
We just took the CDC numbers as they are for this.
Okay,
So,
so
we
you
didn't look into that. I mean, I think there's no question that there's substantial over-reporting in some places at some times, and there was probably also under-reporting in other places at other times, especially early on when there was limited testing. So it's hard to say. Until you can do a comprehensive death certificate or chart review on all of it, which I'm not sure we'll ever get. It is hard to answer that question. I will say, though, that using all-cause deaths as one of the measures sort of addresses that problem indirectly, because it's regardless of cause, this is the total number of deaths. And so I think by using half of our metric, using the all-cause numbers, it sort of gets to any questions about classification problems.
Now, you took all three factors, the health, education, and the economy, but did you also do separate measures for each one, how the states ranked in terms of death outcomes?
Yes.
Or what does that look like, the top five, the bottom five?
Well, I actually don't have it ranked that way in front of me.
Okay.
But I think you might have that.
I happen to have
You
a
happen to
complete
have the
study
paper.
here.
You have the complete study, so I can answer it.
Why don't I
can
give you-
answer that for you pretty easily. So, if you look if people want to look in the study, we've got
Let's title the study, and you
in
can
the sections that we have on each one of these. So I think we have the economic section first, then we have the education section. If you go to the mortality section, we presented a number of different ways so that people can see sort of the overall. So we've got it before and after the adjustments. So the way we've done it, after the adjustments, the numbers that we used, we've got Hawaii at the very top, which is probably not surprising considering, as I said, they became a total fortress and largely did keep COVID out, although at enormous cost. Then we've got Vermont, Maine, Oregon, New Hampshire, Washington. And so what you kind of notice is there were some regions, the Pacific Northwest and New England, that just, for whatever reason, were not hit as hard as the rest of the country. And they had better outcomes. And that sort of pattern tends to happen, you look throughout the list, you get sort of regional clustering effects. And one of the interesting things, a lot of people say, you've got all the way on the bottom, you've got, Nevada, New York, New Jersey, DC, Arizona, New Mexico's near the bottom too. And you kind of say, well, maybe it was bad policy response, or maybe it was just timing. I mean, the places that were hit very, very early, New York, New Jersey, DC, they have the worst outcomes on this. Maybe they were just completely caught off guard, or, maybe they were caught off guard and then did really dumb things, like put people on ventilators that killed them.
And sending old people back into nursing homes where they promptly
almost
died.
Definitely a factor.
Yeah.
We cite a study in here, a pretty good study by Carl Hennigan from Collateral Global, that they looked at this question of, do nursing home policies matter for COVID outcomes? And they said yes, and they had a number of factors that they found. And so that's a pretty consistent pattern globally. The places that really got nursing homes wrong had a big jump versus what you otherwise might have seen regionally or based on these wave patterns. But, if you look...
And Cuomo's New York ended up 49th.
New York, 50th on deaths, and I think 49th overall. I think we've got Nevada slightly worse, but New York is right there at the bottom. So they had a very, very bad COVID outcomes. And of course, they also had bad economic and education outcomes. So
let's dig into the other two, and then we can circle
Sure.
back around it. So how'd you do the economic metrics?
The economic metrics, again, it's a two-component score.
This is the Bill Walton Show. I'm here with Phil Kerpen of American Commitment, and we're digging into his very revealing study about what worked and what didn't work during the lockdowns and the result on educational attainment and health and the economy. Phil?
The economy score also has two components. We used GDP by state from the Bureau of Economic Analysis, and we used employment. And the way that we did employment is we did, on a monthly basis, we did the change in employment versus the pre-pandemic period, and then we sort of added all of those up. And again, we did adjustments on this as well to adjust for kind of the uncontrollable factors as we saw them. And so things like travel and tourism and oil and gas that were just going to be nuked no matter what because of the global effects, we essentially regress them out. And so we have a industry, we have the economic components are adjusted as if every state had, an average amount of their GDP and employment in those sort of highly pandemic sensitive sectors. And so you look at a state like Nevada.
I've seen your equation, so we're going to have to take your word for it that you did it right. I know you did.
I know we did it right because I asked Casey to do it. And so Casey Mulligan from the University of Chicago did the regression, and so we're confident on that.
So what about let's talk about the educational piece we talked about before we started the show. What's happened with kids?
Well, what we used for that is we obtained data from a company called Burbio that very closely tracked schools across the country. And what we used was the percentage of in-person learning for the 2020-2021 school year, so that we would have a complete school year with a complete data set. And the way they did this is if they were full-time, it was 100% weighted. If they were on a part-time or hybrid schedule, it was like 50% weighted. And then they produced a score for the entire school year, what percentage of the instruction was in person in each state. And that's the score that we used. And so it's arguably it's a little bit of an input as opposed to an outcome because we don't have academic achievement numbers yet. But I'm extremely confident that the effect on achievement is going to mirror very, very closely the amount of in-person instruction that took place, because we've now got a number of studies that show that remote instruction was essentially equivalent to no school at all. We've got several studies now that show if you were remote for 6 months, you're 6 months behind. If you were remote for a year, you're a year behind. There's a one-to-one there, which suggests that it was very, very ineffective. And so using the percentage of in-person instruction as we do in this study, I think is going to give a pretty good measure of what we're going to see in terms of outcomes as well.
So you put this together and you put it in your equation machine, and what you come out with in terms of the rankings for the states, and then I want to talk about what policy conclusions we need to draw.
The way we put it together is we used what are called z-scores, which is essentially the number of standard deviations away from the mean that each state was in each one of these categories, and then we sum them. And so it shows you, it sort of gives you an equal weighted score, how much better or worse than average each state was, and then we transformed it to a 0 to 100 and gave them letter grades, so it would be something people are more familiar with and can kind of wrap their arms around and understand. And what we found at the top, the states that got A+ were Utah, Nebraska, and Vermont. The A's were Montana, South Dakota, Florida, New Hampshire, Maine, and Arkansas. And then on the other end, the states that did really, really badly. And by the way, to be near the top, you needed to do really well in at least 2 of 3 of the categories. And to do really badly, you had to be pretty bad in all 3 to reach kind of the bottom. The states at the bottom had very low scores. They were sort of across the board, poor outcomes. And the F's were Illinois, California, New Mexico, New York, District of Columbia, and New Jersey. So no big surprises there, I don't think.
Now, how did you measure the degree of lockdown? I mean, there are vaccine mandates, there are masks, there are distancing, there's shutting businesses. How did you measure the degree of severity that each state took to bring this about?
We didn't try to quantify that. There are some measures out there of stringency metrics and things like that. We looked at them and we didn't think they were accurate. We didn't like them. And so we just did the performance metrics that we talked about. One of the things we did, though, is we did a scatter plot comparing the economic score to the mortality score. Because if the lockdown measures were effective, you would think the states that withdrew from economic activity would have a benefit. You would think that there'd be a relationship. And outside of Hawaii, there was no relationship. So withdrawal from economic activity did not correlate with better health outcomes. And I think that's kind of the main finding.
So the states that shut down businesses arbitrarily, the famous ones being shutting down one department at Home Depot and not another.
I think in Michigan they banned selling seeds.
They were partitioning the stores. didn't matter.
It didn't matter. It didn't have.
It
any,
just hurt.
didn't
It
have
just
any-
it just hurt. It
created
just hurt
economic
the small
harms.
business
Yeah,
people.
it just created economic harms. There was no health payoff to it at all. And we've got a number of studies now, both internationally and domestically, that kind of find the same thing, that lockdowns may have a timing effect. They may delay some of that, but they really don't have an effect.
But what I want to dig into a bit, maybe you haven't studied it, but I think I'd like to speculate, is if you're sitting there as a governor and you've got this range of things you can do, from shutting down businesses to requiring social distancing to closing schools to requiring vaccines, requiring masks, the whole smorgasbord of stuff. Was there any one of those that proved to be effective, or did the study not go into the individual measures?
We didn't really look at that in this study, but I can tell you from having reviewed.
And by the way, we don't have to stay in the four walls of the study. You've been tracking all this.
Yeah,
so
I think the almost every time a new policy is announced, you got some short-term benefit. So, which is interesting. It didn't really matter what the policy was that was announced. So you come out and say, we now have a policy, everyone has to wash their hands all the time. You probably got the same short-term benefit if you said all these businesses have to close. And I think that what happens is you get sort of these event effects where the announcements cause people to say, wait a second, I'm going to be careful, I'm not going to interact with people. So that behavioral response has some benefit, but the actual substance of the policies, which are actually forcing and requiring people to do, don't seem to matter very much.
So, have you done any work in there on the difference between germs born on surfaces versus airborne? One of the things I remember for the first year, we were wiping everything.
Yeah, that was completely.
And it turns out that it's not transmittable.
Wrong. That was completely wrong. It was basically, it ended up being essentially zero surface transmission.
What else did we get wrong from the very outset?
Well, I think that the initial belief was that there was surface transmission, fomite transmission from surfaces or from clothes or whatever, and they also thought that most of the transmission was from droplets, like spit, and it turns out that it was almost all aerosol transmission, which meant that the distancing really didn't make much difference. If you're in a poorly ventilated room and aerosols can hang in the air for hours or even days, you're going to get an exposure if you're 10 or 20 or 30 feet away. Whereas, when they thought it was droplets, the difference between 1 feet or 3 feet or 6 feet was really important. And so it ended up being about settings.
Setting where the aerosol might be airborne that way.
Yeah. And of course, early on, they also seemed to think that there was significant outdoor transmission, and it turned out that that may be almost impossible to get a transmission in an outdoor setting.
That's the reason they
hugging and
arrested
kissing
that
someone.
Surfer in Malibu who was surfing without a mask.
There was one, there was one like European soccer game very early on that they said was a big super spreader event, and it was outdoors, and this was the thing that they pointed to. And and of course, they also took like buses. The whole town took buses to it, so it might have just been that. And there were other aspects to it. But I'll tell you, I watched some of the video of it because I was like, wow, there was one outdoor super spreader. I wonder how. So I watched the video. They had like 4 goals, and after every goal, like every single person was hugging and kissing, and I'm like, I don't think this is typical interactions that we see in other outdoor contexts. I think
it doesn't happen at the NFL game.
It was very, very atypical. And so I think that, we could have had zero disruption to anything that goes on outdoors, and I don't think there would have been any more transmission for us. I think that was a big one. And but I really think, the biggest mistake that we made was closing schools. And I think we're going to have massive long-term consequences from that. And even very, very early on, you look back and say, well, how did we make this mistake? The very first study on school closures, which was published, I think, in Lancet, said we don't know much about the transmission dynamics of COVID, but if it's transmitted like flu, where children are a very important transmission vector, then prolonged school closures could reduce overall mortality by like 2%. This was their claim. And you go back and you look at this now and you say, well, it turned out it wasn't transmitted like flu at all. Children were a much less significant driver of transmission with COVID than they are with flu. But you think about, you're going to deny kids a year of school to try to reduce mortality by 2. Yeah, it was. Even before we knew better, we should have known better than to have these prolonged school closures. And even early on, I think A lot of Europe, they closed for 4 weeks, 8 weeks, and then they were back. And they didn't see major outbreaks or problems. And we were here in the U.S., and I remember, Trump did this big event at the White House. I was actually invited to it. And they had American Academy of Pediatrics, all these other experts. They said we should have schools open. We're going to have normal. This was, I think, June or July 2020. And so we were going to, we were on track to only lose, a month or two at the end of that 2019-2020 school year. And it just became, there was just this insane political backlash after that event. I want to say 10 days after that event, American Academy of Pediatrics reversed their advocacy, literally in a joint statement with the teachers' unions. They said, no, actually, schools should close. Okay. And that, to me, was sort of the pivot point.
Yeah.
And it, it actually got even worse. You might have thought, okay, they're doing this, they're going to lock all these kids out of school, cause all this harm just to win an election, or just because they hate President Trump and want to prove him wrong. But then Biden came in, and we had an almost literal repeat of that, because remember, January 2021, we thought we were going to get guidance from CDC finally saying all the schools should be open. And then what happened is they ended up putting out a document that kind of said the opposite. They kind of said, no, actually, we want them all closed. And everyone was trying to figure out how this happened or what was going on. And then we later found out from FOIAs that the teachers' unions dictated that guidance to the CDC. They told them to close the schools. And of course, at the time, they were trying to do a big shakedown to get another $100 or $150 billion in the CARES Act bill. And so, obviously there was big money politics involved. But, I think that I think it's shameful what we did to children. They were always at extremely low risk. In fact, children were at normal risk during the pandemic, which is to say the risk to children with this virus was no different from the other viruses they normally encounter. And so they were not at elevated risk, and they were not major drivers of transmission, and yet we upended their lives and really denied them normal life for as much as 2 years. And there haven't been a lot of apologies. I think a lot of them eventually admitted they were wrong, but there haven't been a lot of apologies.
This is Bill Walton show. I'm here with Phil Kerpen, and we're talking about the catastrophic policies that were wrought during the pandemic and how it hurt kids the most. And we're going to pay a big price for this long term because of the lapses in education, but also we're talking about the politics of this. And Phil, I mean, you studied this more than I. It seems to me like this is the most politicized health issue or pandemic in history. I mean, this thing was immediately grabbed and people took sides politically, and that remains the case up until now.
Well, one of the problems we have now is that you have an awful lot of people who think that if they say, okay, normal life, normal schools, that'll involve admitting they were wrong. And for some people, that's, they can't possibly do that.
Well, and not only admitting they were wrong, but I think they're criminally liable in many cases. I mean, if you think about the number of excess deaths, and we haven't talked about that yet, you have COVID deaths, and yet you're saying there are all these other measures that were taken that hurt people. And you had deferred treatment for cancer, you had people not getting dialysis, you had people that were doing drugs and alcohol and all that, and the number of people who suffered, there's been no proportionality to this at all.
Yeah, it's a little bit hard to get a handle on exactly how much non-COVID excess death there was, but it's somewhere on the order of 100,000 deaths per year for the last 2 years. So we've got about 200,000 extra non-COVID deaths. And, you have to attribute those to the policy response in large part, I think.
And Jim Agresti's also done a number of, he calls it person years that are lost. And his view, and I think a lot of other people have come up with this, is it's not just the deaths that are occurring now, but it's the way lives have been shortened.
Yeah, I think it's a really good point. And I think that, the number of life years lost for the non-COVID excess is definitely on average much higher than the COVID, because you've got younger people that are dying. Particularly the drug and alcohol deaths have been much younger than the COVID deaths, and they're up substantially. The vehicle fatalities are up a lot, which is kind of counterintuitive. A lot of people thought early on, oh, well, everyone's staying home, so we're going to save all these lives on the road.
Vehicle fatalities are up?
They're up substantially, which is interesting because a lot fewer miles have been driven. But, I think that what happens is when there's not traffic, people speed more. And it turns out that the accidents they have are more likely to kill at high speed. And so the vehicle fatalities have been up substantially. The other thing that's interesting is if you look at the place of death data, a lot more people are dying at home than we normally see, which makes you wonder, how much are we having, people not seeking medical treatment because they've essentially been misled to believe the hospitals are too busy for them, and they have, an acute cardiac event, they have a stroke or a heart attack, and they don't get treatment, and they die as a consequence of that. And so those, I think, are some of the reasons we've seen significant increase in short-term, the excess deaths that have already happened non-COVID. But then there's this other question, which you raised, which is, what's the long-term impact of discouraging so many people from engaging with the healthcare system? How many cancers are going to be detected much later with a much worse prognosis as a consequence of people staying away from healthcare for a couple of years? And the other thing that really drives me nuts is, I look at the hospital utilization numbers pretty closely, and we have not had a single month in which inpatient admissions or ER visits in this country were higher than 2019 since the pandemic started.
Before the pandemic?
Yeah. We've not reached normal levels in a single month since the pandemic started. That's how much utilization has collapsed. So even when we've had the big COVID waves, other utilization has gone down
dropped.
so much
Has dropped.
that our overall utilization has still not reached 2019 levels in any month. And, that's the healthcare crisis that they never really talk about. They don't.
Well, that's yes. I'm sorry, I'm just jumping.
Yeah, well, right. I mean,
I'm violently agreeing.
So we have all these stories, all these headlines about, oh my God, there are all these COVID people showing up at the ER. And you say, okay, but wait a second. If the total number of ER visits is still lower than it was in 2019 for this month, when you have then what is that? Who's not showing up?
Well, you know this already, but one of the iron laws of economics is the seen and the unseen. And, Adam Smith called it the invisible hand, but we've got the things we see, which are the COVID numbers maybe, but what we're not seeing is everything else that's bad that's going on. And that's what's not getting reported. Even now, you listen to the local news and somebody will come on, well, hospital admissions have risen. And then they just stop, like there's no other news. And, what's that mean?
Well, I like to look at the hospital numbers I like to look at the hospital numbers, not the COVID chart that you see on TV all the time, but I have a different chart that I like to use, which is the total number of staffed beds, and then as a subset of that, the ones that are occupied, and then as a subset of that, the ones that are occupied with COVID, because it puts into perspective what a small percentage, even in the worst sort of COVID waves, what a small percentage of total capacity is actually used by COVID. And the other thing that's kind of interesting when you look at it that way is the top line, the number of staffed beds, has kind of gone down consistently throughout the pandemic, which is not what you would expect if you've got a stressed hospital system. You would think we'd be adding capacity, but we were actually losing capacity.
Well, you talk about the huge cost in education, having it shut down, the kids, the education lost, and that'll linger for decades. But I'd also argue the economy. You can measure unemployment, you can measure GDP, but the impact on the supply chain. Part of the reason we're looking at inflation now, part of the reason we're looking at shortage of many things we used to take for granted as Americans is because of what we did in shutting down all the small businesses. And people don't understand the economy. You understand this is such an interconnected, interwoven fabric that you take one piece out and all of a sudden nothing else quite works. And we injected that toxicity into our economic system. I still don't think we've recovered.
Well, it's very hard. The economy's not a machine that has an on-off switch, and you can just shut it down for a while and then turn it back on, and everything's fine.
I know Steve Moore, the co-author in this, talks about this all the time. I mean, what did you guys conclude from your study?
Well, obviously, some states were hit much harder than others, and some, the states that had relatively short disruptions were able to recover, pretty quickly. And we just have this massive disparity. And as I mentioned, I think we've got a dozen states now where employment is higher than it was before the pandemic. which means the rest of the states it's not. And we've still got, I think, 5 or 6 states that are at 95%.
Yeah.
So they've still got a substantial, kind of employment gap, which, the national numbers sort of cover that up. Nationally, you say, oh, everyone's working. Well, there's still a lot of states where that's not the case. And, it's the other aspect of this, of course, is the monetary policy. I mean, if you shut a whole bunch of things down, but you keep consumer spending afloat essentially by creating money, now you've got more money chasing fewer goods.
Right where we are now.
Yeah, exactly. I mean, this is not. we shouldn't be surprised that we're seeing inflation run where it is, considering what Fed policy's been.
I thought it was all because of Vladimir Putin. I'm joking. No, these seeds were sown for this a while back. I mean, with our federal policy and our fiscal policy and sending out all these checks. So I want to get, though, you've been following this and a lot of other things. What are your policy recommendations? I mean, one of the things I'm seeing here is the benefits of federalism, which is we get each 50 state more or less making their own decisions about how to handle this. I think your study proves that some policies work, some didn't. But what else? What are the takeaways here we can draw from?
Well, I definitely agree about federalism. I think that one of the saving graces for the whole world is that there were states in the United States that didn't go along with this stuff because there weren't that many countries that didn't. I mean, it's basically Sweden, and I mean that's about it in terms of major industrialized countries that didn't adopt all this stuff. So having states like Florida and South Dakota and Texas you could point to as examples economically, I think is very, very important. So there's a huge benefit to federalism. But I think the big takeaway, which I think is something we used to know, is that public health policies should not be coercive. Public health policies should be about providing the best information you can to the public so that people can make their own decisions. And I think that if you do that, people will generally protect themselves. I think one of the craziest assumptions early on was this idea that, if government didn't step in with a lockdown, then the curve would just go up forever. But that's not what happens. Human behavior limits epidemics automatically because when you hear there's something bad going around, you try not to get it.
Yeah.
And so, I really think that we need to go back to the idea of public health being about information and communication, not about coercion and force and shutdowns and lockdowns. And that's got to be the number one lesson learned, is that coercion is not effective and is extraordinarily destructive when it comes to these health measures. And, if our public health authorities can't learn that, and I'm not sure I'm not sure they're not going to make things worse just in general because they're going to put out information. People will say, oh, those are the same crazy lockdown people and whatever, and they'll just be discounted and ignored in large part. So I think the idea, I think we've got to substantially reform these institutions and downscale them and make clear that they've got a information processing and that's about it. I don't think the idea of the CDC having rulemaking authority I find completely insane.
Well, maybe other way to think about this is that you've got to think about this as a piece of overall public health. And it looks like we put everything into the immunology world, and everything was about the virus, when in fact the virus is one bad thing, but there are 99 other things that you got to address if you care about public health and social welfare, and that didn't happen.
Yeah. Well, I think that that's why the role of public health should be to provide information and let people make their own choices. Because people have all kinds of different things that they value and that are important to them. Including education, including generating income, and one of the traps we fell into, I think, Bill, is we let people come out and say, health trumps everything else. It doesn't matter if we destroy the economy. It doesn't matter if kids don't learn. Health is the one, but everything is health in a sense, right? If you're poor economically, you have much worse health outcomes. We have a million studies that show that. Educational attainment is very directly related to health outcomes. There's about a 5-year difference in life expectancy between high school graduates and high school dropouts. And so in the long term, all of this is health. In the long term, everything related to quality of life, affects life expectancy, affects health as well. And so I think that we need to not be blinded about this is the one thing that's right in front of us. And I think that people, when you decentralize decision making, people are very, very good assessing these kinds of trade-offs for themselves because you do it all the time. That's kind of what life is. But when government becomes monomaniacally obsessed with one thing, you get these disastrous outcomes kind of on everything else. And then you go back and you look and say, they didn't even do the one thing very well. It didn't even seem to work very effectively for their thing that they obsessed about. And so, I think we need to have a lot more humility about what's possible. I mean, the idea that you were going to stop a highly infectious respiratory virus from working through the population, I think, was always folly. And frankly, I think we should have invested a lot more in treatment than we did. We had very effective treatments through the entire Delta wave. We had extremely effective treatments with the monoclonal antibodies that worked very, very well for Delta. But in the vast majority of states, people didn't have access to them, didn't know about them. Most of the public health officials weren't talking about them. They weren't making them available. So that was a real failure. And, you become so obsessed with the idea of, we're going to prevent everyone from being exposed, which is impossible. But I think I think there was one of the most insane factoids of this entire pandemic is that we spent more on bailing out the New York City subway than we did on treatments total. Well, what does that say about relative priorities?
Well, it means we need leaders, not politicized wonks. That's terrible. I mean,
Isn't that horrible?
Yeah,
and
that's
the other, but then the
unbelievable.
other aspect of it is, okay, but we also had the wrong system for developing and distributing treatments because we decided we were going to do it all through the government. They were going to have a purchasing monopoly, and they were going to do the weekly allocations and decide how much each state gets. And, at one point we had 4 different versions of monoclonal antibodies from 4 different companies that were all working pretty well. And you kind of think, if we didn't have the government as monopoly purchaser, there would have been ads everywhere. They would have been competing like mad. There wouldn't have been shortages. There would have been,
Now that you've written up the analysis of what worked and what didn't work and evaluated states, are you also going to follow up with I think you should, on a paper on policy prescriptions going forward, just the kind of thing you're talking about? I mean, I think a handbook for people, at least for citizens, to use to hold their government accountable would be extremely useful.
Yeah, it's a good idea. There are a few kind of follow-up analyses that we need to do. One is a lot of people have been asking us why did the southwestern states do so poorly? Why did the border areas do so poorly? And so I think we need to kind of figure out an answer to that. And a lot of people point out, the people who think that lockdowns are great like to sort of crow about how bad Arizona's mortality numbers are, because they are very bad. But then you point out New Mexico is equally horrible right next door. Well, they did every lockdown and shutdown and school closure and so forth. So I think there's some regional factor there that we need to sort out. That's kind of on our list to figure out. And there are a number of other things. But I think we do, to the extent that we can understand what happened, we've got to prevent these mistakes from being made again. So I think some sort of a policy recommendations, takeaways thing would be helpful. Although I think that it might be better if that comes from people with a little more health credentials as opposed to economic credentials. So I don't know. We're working with some other. The answer is yes.
Okay, let's do it.
We'll figure out the best way to get something like that.
I know. I'll try to help make that happen. So Phil Kerpen, thank you. Anything you'd like to add to this? I guess excellent analysis and diagnosis of where we go from here.
I just think that whatever else we do, we've got to give kids normal life. I think that's the crucial, most important thing right now. 2 years is way too long. For me and you, it's a blip in long life. For kids, it's their whole world. It's everything they've known, and it's too much. It's too long. And even if we have another horrible wave, or if we have another brand new horrible virus, we've got to do right by the kids first and foremost. That's my biggest takeaway.
Great, thanks. This has been the Bill Walton Show. I've been here with Phil Kerpen of American Commitment. And Phil, where can we find you?
You can find me AmericanCommitment.org. You can find me CommitteeToUnleashProsperity.com, which is where you can sign up for the daily newsletter that I do with Steve Moore and John Fund. And you can find me on Twitter. I'm a little bit of an addict on there. That's my last name, Kerpen, K-E-R-P-E-N.
K-E-R-P-E-N.
Yeah.
So you haven't been banned on Twitter.
Not banned yet. And if Musk's transaction closes, maybe conservatives will be.
That'd be a
clear.
happy thing for everybody.
Yeah, we'll see. He supposedly has the funding secured, but he's said that
right.
before, obviously.
Well, anyway, thanks for joining. And as always, tune back in here where we dig into what's true and what's right and what's next. And we're trying to stay ahead of the curve, and hopefully we've provided some information here that'll help us deal with the next pandemic effectively. Anyway, so thanks for tuning in, and we'll talk soon. Bye. I hope you enjoyed the conversation. Want more? Click the subscribe button or head over to thebillwaltonshow.com to choose from over 100 episodes. You can also learn more about our guest on our Interesting People page. And send us your comments. We read every one, and your thoughts help us guide the show. If it's easier for you to listen, check out our podcast page and subscribe there. In return, we'll keep you informed about what's true, what's right, and what's next. Thanks for joining.